Hello everyone, my name is Zoe Poucher, and today I will be talking about the current status of and future directions for research on the mental health of elite Canadian athletes. Before we begin, I would like to acknowledge my collaborator on this presentation, Dr. Tamminen, and thank the ISSP Organizing Committee for inviting us to put together this symposium. Today I will review current trends in research on the mental health of elite athletes. I will then highlight some methodological considerations and topics for future study based on these trends. I will also discuss issues in applied and clinical practice, as well as some considerations for future research in this area. A large body of literature has explored the prevalence of mental disorders such as anxiety, depression, general psychological distress, anger, substance abuse, and eating disorders among elite athletes. For example, Gulliver and colleagues found that close to 50% of the 224 elite Australian athletes they surveyed met the diagnostic criteria for at least one of the assessed disorders, which included depression, eating disorders, psychological distress, social anxiety, general anxiety, and panic disorder. Much of the existing literature in this field focuses on depression, anxiety, and eating disorders and has highlighted the comorbidity of these. For example, Lee and colleagues surveyed nearly 1,000 NCAA athletes in the United States and found that 29% reported symptoms of anxiety, 22% reported symptoms of depression, and 49% of the athletes who reported any symptoms at all reported experiencing symptoms of both depression and anxiety. There is also a large body of literature suggesting that elite athletes are more likely than non-athletes to experience an eating disorder, and athletes with an eating disorder have been found to have lower self-esteem and display higher levels of depression and anxiety than those without an eating disorder. As awareness of mental health has increased, research on the mental health of elite Canadian athletes has followed suit. For example, a recent longitudinal study identified the prevalence of symptoms of depression, anxiety, and eating disorders among elite Canadian athletes at 4 times over the course of a pre-Olympic and pandemic year. The results indicated that during the first year of the pandemic, between 37 and 41% of the athletes met criteria for one or more of depression, anxiety, and eating disorders, which reflects the rates of disorder documented among elite athletes in other countries. Additionally, more women met the criteria for disordered eating than men at each time point, which is reflective of much of the research both within and beyond sport. In this longitudinal study, symptoms of each disorder were significantly correlated at each of the 4 time points, which is reflective of the documented comorbidity between mental disorders. Perceived stress was a positive predictor of all 3 disorders at each time point, and there was little change in the levels of each disorder across time. This finding may be related to the pandemic, as athletes were under very high levels of stress throughout the entire year, so their symptoms may not have changed much. Given the evidence that a large number of athletes are reporting symptoms of mental disorder and that elite athletes are less likely to seek help than members of the general population, researchers have also focused heavily on understanding the perceived barriers to seeking help for a mental disorder. Some identified barriers include a lack of time, a lack of knowledge around mental health, and negative help-seeking experiences in the past. However, elite athletes consistently identify stigma as the primary barrier that prevents them from seeking help. Many researchers have developed interventions to improve athlete help-seeking, but most of these have focused on increasing athletes' awareness of mental health. While these interventions are really valuable, as long as athletes perceive stigma surrounding mental disorders, the rates of help-seeking will likely remain low. In addition, there is very limited research that has looked at whether athletes' public statements about mental health and mental illness are related to the likelihood that others will seek support. In other words, does seeing a famous athlete talk about mental health increase help-seeking among other athletes? In reviewing the research to date, there are several methodological issues to consider in advancing this area of research. Much of the research on the mental health of elite athletes has adopted quantitative studies that are retrospective and cross-sectional in nature. While valuable, researchers need to consider alternate modes of data collection to further advance our understanding of athlete mental health. For example, researchers should consider implementing longitudinal research designs to identify within and between athlete changes in mental health. This may enable researchers to draw stronger conclusions and further understand the trajectories of mental health in athletes. Researchers should also consider similarities and overlap between constructs that are commonly studied in sports psychology with constructs used in the broader field of psychology and psychiatry. Sport researchers should consider how research findings and concepts on the topic of mental health can be used to inform their work exploring the experiences of elite athletes. For example, both depression and burnout are characterized by emotional and physical fatigue or exhaustion, loss of interest, and a loss of pleasure. While these two concepts may represent conceptually distinct entities, the similarity in their symptomology likely means that research on depression in the broader field of psychology and psychiatry could inform future research within the sports psychology field on burnout. Lastly, it is important for researchers to conduct qualitative studies to explore athletes' experiences of mental health and understand their stories directly. In addition to the methodological considerations for future research, there are several important topics for future research in the field, including the impact that elite sport environments have on the mental health of those who work and train within them, the impact of social media and technology on the mental health of elite athletes, and effective mechanisms for combating stigma in sport. For an additional discussion of these topics, please see our recent paper, A Commentary on Mental Health Research in Elite Sport, or the special issue of the Journal of Applied Sports Psychology, which focused on mental health in sport. There are a few current issues related to applied and clinical practice that require further attention and research as well. For example, new and innovative clinical practices as well as their implications should be further studied. Understanding the merits and drawbacks as well as the implications of novel modes of delivery such as online and remote therapy and online group therapy may contribute to further enhancing the care available to athletes. Moving forward, the best practices for service delivery to elite athletes should also be identified. It is important that questions such as what are the best modes of care and what works best from an athlete's perspective are answered. Addressing questions such as these may improve the delivery of mental health services to athletes, which in turn may improve athlete mental health. It is also important to recognize that often athletes are performing at elite levels when they are still adolescents or young adults. Therefore, providing care for elite youth athletes requires knowledge of developmental and child psychology. Future research should explore applied and clinical sports psychology for youth athletes as a specific population. In summary, recent research has demonstrated that elite athletes are at risk of experiencing various mental disorders and that there are many barriers to seeking help for this population, namely stigma. Given these findings, it is important that additional research is done on this topic in order to further understand athletes' experiences with mental health and learning about how to improve the mental well-being of this population. Additional research should include topics related to applied and clinical practice, and researchers should conduct more qualitative and longitudinal research. In this symposium, we have brought together a variety of perspectives on the topic of mental health in elite Canadian sport, including an examination of the sport journeys of Canadian national team athletes diagnosed with a mental disorder, an exploration of Olympic and Paralympic athletes' well-being in the lead-up to the 2021 Tokyo Games, a discussion of the role of identity in shaping Canadian athletes' adjustment to the COVID-19 pandemic, and research examining the acceptability and appropriateness of a mental health service delivery model in Canada. Thank you so much for listening, and we hope you enjoy the rest of the symposium. I would now be happy to answer questions or would be glad to chat via email if you would prefer to reach out that way. Our contact information is on the slide.